Hello friends, in this video we talk about 8 nighttime signs of diabetes. Like frequent urination, increased thirst, blurred vision, sexual problems. When someone with diabetes doesn't have enough sugar, glucose, in their blood, it's called diabetic hypoglycemia. Glucose is what gives your body and brain energy, so if you don't have enough, you won't feel well. For many people, low blood sugar, hypoglycemia, means having a blood sugar level below 70 mg per deciliter, or 3.9 millimoles per liter. But everyone's numbers can be different. Due to this hypoglycemia, some people face extreme fatigue, night sweats, slow healing of wounds. If this problem increases further, then it also affects the sexual life of both men and women, which we will see at the end of this video, so you are requested to watch this video till the end, and like and share the video and subscribe to the channel. So let's start from sign number first. Frequent urination. Frequent urination, especially at night, is a telltale sign of diabetes. When you have diabetes, your body struggles to regulate blood sugar levels. Normally, the hormone insulin helps usher sugar from the bloodstream into your cells, where it's used for energy. But in diabetes, either your body doesn't produce enough insulin, type 1 diabetes, or your cells become resistant to insulin's effects, type 2 diabetes. This excess sugar hangs around in the bloodstream instead of being absorbed by your cells. Here's where the kidneys come in. They act as filters, constantly cleaning your blood. When there's too much sugar present, the kidneys go into overdrive trying to remove it. To accomplish this, they pull extra fluids from your body and create more urine. This is why people with uncontrolled diabetes experience frequent urination, both during the day and throughout the night. This constant need to urinate can disrupt sleep significantly. Imagine waking up multiple times a night to use the bathroom. Not only does this fragment your sleep, but it can also lead to feelings of fatigue and irritability. Sign number second is increased thirst. Increased thirst, medically known as polydipsia, is a common nighttime symptom in people with diabetes. It's a consequence of the body's attempt to rectify the high blood sugar levels present in diabetes. When you have diabetes, your body either struggles to produce enough insulin, type 1 diabetes, or can't use the insulin it produces effectively, type 2 diabetes. Insulin is a hormone responsible for ushering glucose, a type of sugar, from the bloodstream into your cells, where it's used for energy. With insufficient insulin, glucose builds up in the blood instead. The kidneys are responsible for filtering waste products and excess fluids from the blood. When they detect high blood sugar levels, they go into overdrive to remove the excess glucose. This process pulls extra fluids from your body's tissues to dilute the glucose and prepare it for excretion through urine. As more fluids are pulled into the urine production process, the body becomes dehydrated. This dehydration triggers the thirst response in the brain, signaling you to drink more fluids and replenish lost fluids. So, the increased thirst you experience at night is your body's way of compensating for the fluid loss caused by the kidneys filtering out excess sugar. Certain nighttime factors can worsen nighttime thirst in diabetic individuals. Here's why. Reduced fluid intake. We naturally drink less fluid at night while sleeping. This means there's less water available in your system to counteract the dehydrating effects of high blood sugar. Increased breathing rates. During sleep, breathing rates can sometimes become shallower or more rapid. This can lead to increased insensible fluid loss through respiration, further contributing to dehydration. Certain medications. Some medications used to manage diabetes, like diuretics, can also increase urination and dehydration. Now we move to the sign number third is extreme fatigue. Extreme fatigue is a hallmark symptom of diabetes, and it can be particularly bothersome at night. This exhaustion stems from a fundamental issue with how your body uses glucose, its primary source of energy. In people without diabetes, the body efficiently converts glucose from food into usable energy for your cells. This keeps you fueled throughout the day and allows for restful sleep at night. However, with diabetes, this process is disrupted. There can be two main reasons for this. High blood sugar. When your blood sugar levels are chronically elevated, your body struggles to get glucose into your cells. This essentially creates a logjam, where there's plenty of glucose in the bloodstream but the cells can't access it for energy. The result is a feeling of fatigue despite having a seemingly abundant energy source. Insulin resistance. In some cases, the body may still produce insulin, the hormone responsible for shuttling glucose into cells. However, the cells themselves may become resistant to insulin's effects. This again leads to a buildup of glucose in the blood and a shortage of usable energy at the cellular level, resulting in fatigue. This impaired energy cycle due to diabetes can manifest in several ways at night. You may experience difficulty falling asleep due to feeling restless or wired. Even if you do manage to fall asleep, your sleep quality may be poor, leaving you feeling unrest and exhausted in the morning. This daytime fatigue can further disrupt your sleep cycle, creating a vicious cycle. Sign number 4 is night sweats. Night sweats, also known as sleep hyperhidrosis, can be a disruptive and uncomfortable symptom for people with diabetes. They involve waking up drenched in sweat, often accompanied by a feeling of being hot and clammy, even if the room temperature is cool. While night sweats can have various causes, they can be a sign of blood sugar fluctuations in people with diabetes, particularly low blood sugar, hypoglycemia. There's a well-defined link between the two. When your blood sugar levels drop too low during the night, your body releases hormones like adrenaline in an attempt to raise them back up. Adrenaline has a number of effects on the body, and one of them is increased sweating. This sweating is a natural response as the body tries to cool itself down due to the surge of adrenaline and the effort to raise blood sugar levels. However, it's important to note that night sweats in diabetics aren't always caused by hypoglycemia. Sometimes, they can be a sign of autonomic neuropathy, a complication of diabetes that damages nerves responsible for regulating sweat glands. In this case, the sweating may not be triggered by a specific blood sugar level but can be more unpredictable. Sign number 5 is numbness or tingling in hands and feet. Numbness or tingling in your hands and feet can be a cause for concern, especially if you experience it frequently at night. This symptom can be a sign of diabetic neuropathy, a complication of diabetes that arises due to nerve damage. Here's a closer look at how diabetes causes numbness and tingling and why it might be more noticeable at night. High blood sugar's detrimental effect on nerves. Chronic high blood sugar levels, a hallmark of diabetes, can damage nerves throughout your body. These nerves transmit signals between your brain and various body parts, allowing you to feel sensations like touch, pain, and temperature. When nerves become damaged due to diabetes, they may not transmit signals properly, leading to numbness or tingling. Why nighttime makes it worse? There are a few reasons why numbness and tingling in hands and feet might be worse at night for people with diabetes. One reason is that fluctuations in blood sugar levels are more common at night. As blood sugar levels drop, it can irritate nerves and cause tingling or prickling sensations. Additionally, when you're lying down in bed, fluid can pool in your legs and feet, putting pressure on nerves and exacerbating numbness and tingling. It's important to note that numbness and tingling in hands and feet can also occur during the day and isn't exclusive to nighttime. If you're experiencing this symptom, regardless of the time of day, it's crucial to see your doctor to determine the underlying cause. Sign number 6 is slow healing of wounds. Diabetes disrupts the body's natural healing process, making it harder for wounds to close and regenerate tissue effectively. This increased healing time applies to all wounds, from minor cuts and scrapes to surgical incisions. There are several factors contributing to this delay. Poor blood circulation, diabetes, especially uncontrolled diabetes, can damage blood vessels throughout the body. This damage narrows the vessels and reduces blood flow, particularly to the extremities like the feet. Reduced blood flow means that essential oxygen, white blood cells, and other healing factors have difficulty reaching the wound site. Without these vital supplies, the body struggles to fight infection, remove damaged tissue, and build new tissue to close the wound. Impaired immune function, diabetes can weaken the immune system, making it less effective at fighting off bacteria and other germs that can cause infections. Chronic high blood sugar levels can interfere with the ability of white blood cells to function properly. This increases the risk of infections in wounds, which further delays healing and can lead to serious complications. Neuropathy, another complication of diabetes, is neuropathy, or nerve damage. This can affect the nerves in the feet and hands, leading to a loss of sensation. People with diabetic neuropathy may not feel injuries on their feet, which can go unnoticed and worsen before being discovered. Delayed treatment increases the risk of infection and slows healing. Sign number 7 is blurred vision. Blurred vision is a common complaint among people with diabetes, and it can worsen at night. This occurs because high blood sugar levels can disrupt the delicate fluid balance within your eye. The lens inside your eye is responsible for focusing light onto the retina, which creates a clear image. The shape of the lens is constantly adjusted by tiny muscles based on the distance you're looking at. However, when blood sugar levels are elevated, fluid can flow in or out of the lens, causing it to swell or shrink. This change in shape alters the lens's ability to focus light properly, resulting in blurred vision. There are a couple of reasons why blurred vision might be more noticeable at night. First, our pupils naturally dilate in darker environments to allow more light to enter the eye. This larger opening can make any underlying focusing issues more pronounced. Secondly, fluctuations in blood sugar levels are more common at night due to factors like decreased activity and hormonal changes. This means that nighttime can be a time when blurry vision due to diabetes is most bothersome. It's important to note that blurred vision at night can also be caused by other eye conditions entirely unrelated to diabetes. Sign number 8 is sexual problems. Diabetes can wreak havoc on your sexual health, affecting both men and women. Here's a breakdown of how it can manifest. In men, erectile dysfunction, ED. This is the most common sexual problem for men with diabetes. Chronic high blood sugar levels can damage nerves and blood vessels, making it difficult for the penis to get and maintain an erection firm enough for intercourse. In women, vaginal dryness, diabetes can decrease lubrication production in the vagina, leading to dryness and discomfort during sex. This can make sex painful and decrease desire. Low libido, reduced blood flow and nerve damage can also affect sexual desire in women with diabetes. They may experience a lack of interest in intimacy or feel less aroused. Difficulty reaching orgasm. Nerve damage can also affect the ability to orgasm or make it less intense. Remember, managing your diabetes is key to a healthy night's sleep and a satisfying sex life. If you're experiencing any of the symptoms we discussed, talk to your doctor. Early detection and treatment can make a world of difference. So, did you recognize any of these signs in yourself? Don't wait. Take control of your health today. For more information on diabetes and healthy living, like this video, share it with your friends, and subscribe to our channel for more informative content.